The 2024 to 2025 flu season has tragically marked the highest number of pediatric deaths in the United States in over a decade, with at least 216 children losing their lives to influenza. This is not only a staggering loss, but it serves as a grim reminder of the ongoing challenges in public health, especially in light of the growing influence of vaccine misinformation and hesitancy. New York, which reported a record 25 pediatric deaths, is a particularly stark example of the toll vaccine skepticism has taken. Health authorities are sounding alarms, pointing to the direct correlation between vaccine hesitancy and the increased number of flu-related deaths. The numbers are chilling. The 2024 to 2025 season's toll of 216 child deaths surpasses most recent years, with the last time the figure reached such a height being during the 2009 to 2010 flu season, when 288 children died. But this year's statistics are more alarming for several reasons. In New York, a state with one of the highest numbers of deaths, only one of the 25 children who died had received a flu shot. The rest, tragically, had either not been vaccinated or were too young to be eligible for the vaccine. This data starkly highlights the critical importance of widespread vaccination to prevent needless deaths, particularly in a time when vaccine skepticism is dangerously high. In recent years, vaccine hesitancy has been fueled by a combination of misinformation, political rhetoric, and growing distrust in public health initiatives. High-profile figures, including Health and Human Services Secretary Robert F. Kennedy Jr., who has long expressed skepticism about vaccines, have contributed to a culture of fear and doubt surrounding immunization. Public health experts are sounding the alarm about this decline in vaccine uptake, especially in light of the growing number of hospital admissions and deaths tied to preventable diseases like influenza. In fact, flu vaccination rates for children in the U.S. have been in steady decline since the onset of the coronavirus pandemic. The data shows a troubling drop from 63.7% in the 2019 to 2020 flu season to just 55.4% in the 2023 to 2024 season. This decline is compounded by a general sense of complacency about the flu itself, with some people mistakenly believing that the flu is no longer a significant health threat. The risks of this mindset are abundantly clear. In addition to the tragic loss of life, there is also the increased strain placed on healthcare systems, which are already stretched thin. The impact of a severe flu season, especially one with high pediatric mortality, can be far-reaching. Hospitals can become overwhelmed with flu patients, leading to shortages of medical staff, space, and resources. This not only jeopardizes the care of those with influenza, but also creates delays and disruptions for patients seeking care for other conditions. The consequences of ignoring the importance of vaccination can ripple throughout the healthcare system, creating widespread challenges that could otherwise have been avoided. Despite these alarming statistics, there is still hope. The flu vaccine remains the most effective tool we have to prevent severe illness and death. However, the efficacy of this vaccine can only be maximized when a significant proportion of the population is vaccinated. With ongoing vaccine hesitancy and misinformation actively undermining these efforts, the path forward is fraught with difficulty. It's critical that public health campaigns intensify, targeting not just the benefits of vaccination, but also addressing the root causes of vaccine misinformation. This could involve improving transparency in the science behind vaccine development, engaging with communities that are skeptical of vaccines, and working to counter the narratives that continue to undermine public trust. The devastating rise in pediatric flu deaths also highlights the urgent need for more robust public health infrastructure. We need better surveillance systems to track flu outbreaks in real time, more effective education campaigns to combat vaccine misinformation, and improved access to healthcare and vaccination in underserved areas. In states like New York, where vaccination rates are relatively high compared to other regions, the number of deaths still reflects the tragic consequences of vaccine refusal. This underscores the importance of continuing to push for better vaccination coverage across the country. The rise in pediatric flu deaths in the U.S. should serve as a wake-up call to everyone, parents, healthcare professionals, and policymakers alike. While the flu vaccine cannot guarantee complete immunity, it significantly reduces the risk of severe illness and death. The fact that the flu is still claiming so many young lives each year should drive a renewed focus on public health efforts to increase vaccination rates and reduce misinformation. Without these measures, we risk seeing even more avoidable tragedies in the years to come.